Hi, I'm Dr. Lucy Bianchi, and today I have Dr. Paul Phelps with me. Over the years, I've had many clients complaining of wrinkles, sagging skin, and all kinds of issues. And after many years of using toxin and filler to correct those areas, we find that a couple of areas have been neglected. And one of those areas is the eyes. All of a sudden, when I do toxin on folks and when I do filler, they're not as happy as they used to be because they're noticing sagging skin or floppy skin or just plain bags that all of these previous treatments are not helping. And that's why I have Dr. Phelps with us here today, because we're going to talk about ways which we can improve some of those things.
Sounds great.
Yeah. Perfect. And then why don't you tell us a little bit about where you were trained and why being an oculoplastic surgeon is so specialized?
Yeah, sure. So thanks for having me, and you're talking to the right person, because as an oculofacial plastic surgeon, all I do all day long is look at the eyelids in the face. And my training, so my background is in ophthalmology, and then I did a subspecialty fellowship in oculofacial plastic surgery. And what that means is that I look at the health of the eye first, and I'm making sure that the eyeball is healthy for surgery, and beyond that, we're making sure that anything we do to cosmetically improve the appearance of the eyes also is taking into consideration the health of the eyeball, to make sure that we don't take a cosmetic problem and turn it into a functional problem. Beyond that, a lot of times I end up fixing functional problems of the eyelid. A functional problem would be like a inturned eyelid or outturned eyelid, or a droopy eyelid that's causing the vision to be obstructed, for example. But I would also say that the first place most people look is the eyes, and they've done studies and look at, where do your eyes go when they're looking at someone's face, and they look at the eyes, and then they look at maybe the mouth, and then back at the eyes, and then maybe at the nose or the ears, and back at the eyes. And so I'd say, a very large percentage of the time that you're looking at someone is looking at their eyes. So there's a really big bang for your buck for improving your facial appearance by focusing on the eyes.
And I think that's why a lot of my clients are noticing that their eyes aren't looking so good, or that they feel old, because they're also looking at their eyes, because that's what we do. Oh, and certainly we focus on whatever it is that isn't perfect. I once had a client many years ago who thought she had ugly knees, and she thought everyone who saw her was looking at her knees. And I'm like, I don't think anyone's looking at your knees. We mostly look at eyes when we talk to someone, because you want to let people know that you're paying attention and that sort of thing. So what I thought was really interesting when we first met was that there are two different words that are very similar in meaning, but I guess they overlap a little bit, but dermatochalasis and ptosis. So I'm sure a lot of people, and I know my clients, everyone thinks they have ptosis, and everyone is afraid of getting that when they get toxin treatment. But what is true ptosis?
Yeah, great question, and I see and hear about this a lot. So true ptosis, the definition is that the eyelid margin, so where the eyelashes are, and the meibomian glands, the different glands of the eyelid that help lubricate your eye, that eyelid margin and the pupil, the center of the pupil, is less than 2 millimeters. That's the true definition of ptosis. And that's a definition, Medicare, Blue Cross, Blue Shield, and all the insurance companies use. So yeah, ptosis means a droopiness, but what we define it as for medically significant is within 2 millimeters of the pupil. Now, can you have an asymmetry, or can you have like a mild ptosis, a moderate, severe ptosis? Of course, typically the upper eyelid sits between 3 and 5 millimeters above the center of the pupil, so that's average. And if you had someone who had one eyelid that was at 5 millimeters above the pupil and the other one is like 3 millimeters, there's an asymmetry, so a relative ptosis. And that can be neurologic in nature, muscular in nature, so can be, a Horner syndrome, which, as you know, it's a problem with the nerves that can indicate more serious problems, or it could be a problem with the muscle because of an underlying condition. So there are a lot of things that can cause a ptosis.
But it sounds like if you do have an asymmetry, that's something that you can correct. You can just get one eye corrected. And is your surgery, the surgeries that you do, is it specific enough where you can get that correction to be symmetric, or do you give them a plus or minus 1 millimeter?
Yeah, so, good question. So, I like to start off and say no one's symmetric. We're all asymmetric, and if you take someone's face who is, commonly thought of as a beautiful person, and you split it in half and make both sides look like one half, they're no longer as beautiful as you thought they were. So, there's more beauty in asymmetry in some ways. But what most people would notice if they're looking at you on the street or just in common interaction is a difference in the eyelid position of 2 millimeters or greater. So, they've had clinical trials where they had people judge, like, does this person have ptosis? Does this person have ptosis? If the difference is 2 millimeters or more, the average observer can notice it. So most people don't have that much asymmetry. For me, a successful surgery is within 0.5 millimeter. So
that's pretty close.
Yeah, so pretty close. Yeah, that's what we're shooting for. So like what I usually quote people is like 95% of the time we're doing a ptosis repair, we can get it within 0.5 millimeter. Otherwise, we'll do a different type of repair. There's a lot of different ways to do the surgery.
Well, considering what Medicare and most insurances will cover, I'm sure most people would not want their eyes to be that droopy before waiting to get that repair.
Correct, yeah, correct. Most of the patients I'm seeing now get it repaired way before it would be medically necessary.
So now if somebody had a non-insurance level deficit, shall we say, and they had it repaired, how long, or what's the lifetime that you give of how long that repair would last before they might need to get that again?
I usually say 10 to 15 years for a ptosis repair. However, it depends 100% on the way the patient's taking care of themselves. And the environment and the genetics both, I guess, play some role. But say, for example, you have someone who has a ptosis due to untreated sleep apnea and floppy eyelid syndrome. Actually, your eyelid can get really loose and droopy, and many times that happens because the eyelid is rubbing on the pillow when they sleep or other factors. So if you correct something like that, but the underlying problem hasn't been addressed, well, in that case, it might last 5 years or less, the ptosis repair. However, if it's someone who's taking good care of themselves, not rubbing the eye, or doesn't have severe allergies that push them to rub their eyes or cause mechanical trauma on the eyelid, then it's probably going to last 10 to 15 years, maybe more.
So what I think is that they should get a surgery with you, and then perhaps if they get regular care with someone like me, getting proper eye creams, using microneedling or any kind of resurfacing that can maintain the integrity of the skin, and could that lengthen the 10 to 15 years, or 10 to 15 years is with you doing those interventions?
I would say, yeah, exactly what you mentioned, which is there's upkeep to any type of plastic cosmetic surgery. There's always going to be some upkeep, whether that's wearing sunscreen, which is like the basic thing, wearing wearing sunglasses, getting those less invasive treatments that help with the skin texture and the color. All those things can be really important in maintaining that investment that you made in the eyelid position.
One of the things that I thought was kind of cool was how you combine the resurfacing with your surgery. So when you do the surgery for ptosis, or just for the sagging eyelids, which is just the dramatic chalasis, you actually resurface the skin. Now, do you do that automatically at the time of surgery, or just if the patient wants to?
Well, so great question. There are a few different reasons why I really want to add laser resurfacing to my procedure. The most common reason is, for example, for like a lower eyelid blepharoplasty. One of the ways that we can do lower eyelid blepharoplasty, which is removing the bags, like bag removal surgery, is to go from behind the eyelid and remove the fat from back behind the conjunctiva so that there's no scar. However, it's kind of like deflating a balloon, so that that volume has gone down and then there are like more wrinkles. So the best way to get rid of those wrinkles without making a cut on the eyelid, which would cause a scar that you can see, is to shrink down the skin with laser resurfacing. So that's the most common use that I have of it. But also it's really nice add-on treatment for patients who have skin damage from sun, just aging with wrinkles. Laser skin tightening is, for the right patient, it can really make a huge difference.
That's what I've started to do for my clients a lot, is just do spot treatment with our resurfacing, because resurfacing the entire face can sometimes feel a little overwhelming, because the downtime is about 5 to 7 days, and there is some things you have to do, not wearing makeup, and you can't even wear sunscreen actually the first day, which is surprising. But for some reason, it feels easier if it's just a small place. Oh, it's just here, I can do that.
Right, yeah. Well, so for eyelid surgery, typically, you're gonna have some swelling and bruising around your eyes, and that can last 1 to 2 weeks. So adding on a laser resurfacing at the same time is like a beautiful combination, because you're healing at the same time, and it acts synergistically to help with overall appearance.
I suppose that would help even with the scarring too, because when you must have to make a cut in there that could be seen. Yeah. Are you trying to keep that hidden as well?
Yeah, so for the upper eyelid, the dramatic chalasis, or extra skin above the eyes, that's typically just an aging thing, although there are a fair number of patients I've been seeing recently who have hereditary dramatic chalasis. So maybe their mom, their dad, siblings had excess skin above their eyelids, and it's hanging down now, and they can't put makeup on anymore. So we remove the extra skin above the eyelids. I usually use a CO2 laser to do that. And when we make that incision or cut in the eyelid, there is a line that's formed, and that line, we make it in the eyelid crease. So most people looking at you would just think it was the eyelid crease, your natural eyelid crease. But if you, close your eye and kind of had someone look up close, or you look with the 12x mirror, you could see a white line that looks a little different than the natural eyelid crease. So treatments for scars, usually what I recommend, there's erythromycin ointment that we give patients in the early phase, while it's healing, to help prevent an infection. Once you're healed from that, about 2 weeks later, then I usually have patients use biocorneum gel or some kind of silicone gel for a week for one tube of like 20 grams, lasts about 2 months. So I have them do that. And other treatments for scars are, steroids, 5-fluorouracil injections, or laser treatment. So actually, the laser that we use, the CO2
at the time of the surgery
is the most powerful treatment for scars.
So getting that at the same time kind of makes it so that there wouldn't be that.
Right.
Over the years, I've had some patients fly out of the country to get their eye surgery done, so I've actually taken out suture, for them, because they're not going to fly back to Mexico or Europe or wherever it is that they've gone. And I've always been kind of like impressed by it. Is kind of a minimal line, and it is really easily hidden. But I think the other thing that I find impressive is that the surgery doesn't cost as much as people think it does. So you don't need to fly to Mexico or Korea or Europe to get it done. It's a pretty cost-effective surgery when you put it in the realm of all the other possible surgeries and treatments that you can have. Because honestly, like if I'm doing like a facial correction with filler, if we're going to do it to completion, that can be $3,000 or $4,000, and that's not something that's going to last 10 to 15 years.
Right.
So I think that when people understand what result they're going to get and how it gives them a lot of bang for their buck, we're going to have more happy people out there.
Yeah, I think so too. And in terms of like cost effectiveness, I mean that's been studied as well for eyelid surgery in terms of aesthetic cosmetic procedures. Patients rate that as like the best value for the dollars they put in. And you're right, if you're getting Botox or filler treatment for a year or two and it's costing you $2,000 or $3,000, or we charge $3,500 right now for an upper blepharoplasty on its own, and that price when it's lasting you so much longer, I think is really, I mean, patients are really happy.
Yeah, it's priceless, really. So I think if insurance doesn't cover something like that, it's still an attainable thing for most people. So in terms of prevention, you can have like genetic ptosis, that there's nothing you can do about. You can have medical ptosis induced by a medical condition. You can also not really have ptosis per se, but as you're saying, just the saggy, baggy skin that you can be born with, which is dermatochalasis. I love that word. It just rolls off the tongue so not easily.
Dermatochalasis, yeah, you could just say baggy eyelids.
Right, baggy eyelids is fun too, and probably more descriptive. But in terms of, we want to make sure that we're protecting the integrity of that skin so that eventually, if we live long enough, won't we all need this surgery?
Good question. So, I would say not necessarily. Not everybody needs it. It's interesting, I take care of like patients with congenital ptosis too. Actually, there are other things that can be done. Patients who have a droopy eyelid and they're born with. I've done probably 2 or 3 of those in the last month for little kids over at Cook County Hospital, where I work a day or 2 a week. And what we do is we attach the eyelid through the brow to the forehead. So those patients, they don't have any movement in the muscle of the eyelid, and so we basically allow the brow to lift the eyelid through connecting those two. So there's something that can be done for everyone. That's kind of like the point I was trying to make. But some patients, as they get older, the upper eyelid actually hollows out. There's something called the enophthalmos of aging, which means the eye and the fat kind of shrinks down as they get older. So those patients wouldn't necessarily be like a great candidate for a blepharoplasty, for example. But I guess what I would say is, to really know what the best treatment for you would be is to get a consultation with someone like me. I really think that oculoplastic specialists are going to be able to give you the best idea of what you need for your specific case, because I do think that some patients go down a rabbit hole on Google or on the internet, and they
very easy to do.
They do, and sometimes they're right on spot, but other times they've been kind of misdirected by information that doesn't have, the full picture, isn't taking the full picture into account. There's a lot of things to think about. As I mentioned, first of all, making sure whatever is done doesn't affect the health of the eye.
Or make you look weird, like perfect symmetry can look weird. And also what you choose to correct. Now, I saw a recent post on Instagram, which is kind of funny. And this is a technique I can do as well, but you can use threads to kind of raise the eyebrows. And if you have like mild sagging skin, or if you want like a fox eyebrow lift, you know, that can look good. But they showed a picture of somebody who just really went too far, and their eyebrows were practically, it was an older lady, practically in the middle of her forehead. And then that looks weird.
Right.
You probably should have had a blepharoplasty done, but just kept lifting and lifting and lifting.
Yeah. So, you know, part of my practice, I don't let anyone leave looking, you know, disfigured or deformed. I mean, that seems obvious to say, but some patients like ask me for things that I just don't feel comfortable having them, you know, make those alterations to their body. If they want to do that, that's their choice, but I'm not going to provide those kind of treatments. What I like to do are treatments that rejuvenate the face, help the patient look like enhanced version of themselves. With what you mentioned, a lot of people have the fear that they're going to look surprised. So they think, oh, you know, don't make me look surprised, especially when we're talking about the brows. And so when we're talking about the brows, what makes people look surprised is when the medial brow is higher. So if the medial brow is higher, that's kind of a surprised look. And that can really only be achieved through like a direct brow lift, where there's an incision made all the way across the forehead, pretracheal brow lift, or like an endoscopic brow lift, where you're releasing all the tissues underneath the eyebrow and the forehead and lifting the whole forehead and brow up. I usually avoid that unless it's directly indicated. And there are some patients who really need that. I have one coming up next week, I think, over at Northwestern. But for the most part, what people really benefit from is like a stitch under the brow that kind of lifts the lateral brow up slightly, because the forehead and the frontalis muscle, that's the only muscle that lifts the brows up. And there's no frontalis laterally. So as you get older, the lateral brow tends to sag and give a more aged appearance. So I like to put a stitch in the lateral brow to kind of give that blepharoplasty a little more longevity without the surprise look.
Right, well that's good, because no one wants the surprise look.
No.
So I think we covered a lot of things that can help with bagging eyes, whether it be just sagging skin, or bagging eyes, or just an appearance you don't like, not being able to see well. There is skin integrity to think about, there is vision to think about, and there's also picking the right specialist to have it done. Now, I'm not an oculoplastic surgeon, so I don't think I can watch a YouTube video and figure out how to do what's taken you probably 20 years to train and do. And so I'm happy that we finally have more specialists like yourself around, so I can safely refer my patients who get to that point to get these surgeries done, so they can look at themselves and like their eyes again.
Great, yeah, thanks. I love it when I'm the first person who sees these patients, the blepharoplasty, the blepharoplasty, ptosis, periocular rejuvenation patients, because I have to say that I also take care of the patients who, you know, have had surgery elsewhere and then have some complications that we have to help fix. So, and it's very, very unusual for those patients to have seen an oculoplastic specialist and then come to me. It's more common that they've seen someone who doesn't really do this kind of surgery all day, every day, and has a complication, and then the patient decides at that point to do their research, and they end up in my lane and seeing me in my office.
So now, what hospitals can people get surgery with you? Do you go out into the suburbs, or are you mainly just in the city?
Yeah, so right now, you know, I mentioned already I'm teaching at Cook County Hospital, so that's not my private practice, that's the academic where I'm teaching and helping patients with trauma and who are underserved. But I'm affiliated with Northwestern Memorial Hospital, so downtown, and then 900 North Michigan, which is also, you know, right on Michigan Avenue. It's in a beautiful, state-of-the-art ambulatory surgery center on the 15th floor. The great thing about those locations, or the 900 North location specifically, is that patients just have a great experience. They're used to taking care of patients who are coming in for more cosmetic procedures, and so the staff treats them well from the beginning to the end. We make sure that the patients are ready to go after their surgery is done. It's a personalized and very good environment. All the patients give us really positive feedback about. And for a lot of patients who are having just upper eyelid surgery done, we can do that in the office. You know, most of the time the patient doesn't even need sedation. We just do those under local anesthesia.
That's convenient. And I can tell you that your office was really easy to get to and has parking, which I think is what makes a lot of people a little nervous when they go into the city. You know, how will I park? Is it going to cost me more to park than it's going to for the surgery?
Right, yeah. To me, that was super important because I know I have patients coming from the suburbs, from Indiana, Michigan, Wisconsin, Iowa, who knows, maybe from further down in the future, but they oftentimes are driving, and I think having parking is super important in the city. You know, a lot of times people have to valet or something like in the city proper, but in our office in Lincoln Park, there's plenty of nice restaurants and things to do, nice shopping, and then also we have parking. So
right, and I think that's key, good parking. And the other thing you have to remember when you get eye surgery is that it's one and done. You're going to go there, and then you're not going to need to go for another 15 years.
Yeah. I would say 95% of our patients, that's how it turns out. You know, just consult, surgery, 1 week follow-up, 6 week follow-up, and then after those 4 visits, basically it's come back and see us when you need us. You know, a lot of times it's many years down the road.
Well, that sounds good. Well, thank you for coming to talk with me today and educating my clients, probably your clients and future clients out there, so they can understand how to better take care of your eyes.
Yeah, thank you so much for having me, and thanks to anybody watching. Please feel free to reach out to us.
Alrighty, take care.